Welcome to the second installment of the Biking with Pain series. I'm Dr. Josh Harris. I'm bringing you pro tips on how to treat common pain problems associated from spending time on a bike. In this episode, we're covering biking with neck pain. Because you're a real pain in the neck. Neck pain is an extremely common problem in the general population. It's one of the most common problems among cyclists. I work with people on a daily basis here in my outpatient physical therapy clinic who experience neck pain. It's often associated with pain that radiates out into the shoulders, down into the shoulder blade area or the mid-back, and patients even have headaches that can arise from the joints in the upper neck that refer pain up into your head. I'm going to show you some of the common causes of neck pain. We're going to discuss bike fit and bike setup and how it can relate to neck pain. Then I'm going to show you some of the things that we commonly utilize in the clinic to help people treat their own neck pain. Neck pain has been linked time and time again in the research to forward head posture. That is essentially when your head protrudes forward this way. This is especially true for us cyclists when our trunks are forward and we have to look up to be able to see where we're going. This can lead to irritation in the joints in the upper neck, which can radiate and refer pain up into the head, commonly experienced as a headache. It can also cause significant strain in the mid to lower neck and the soft tissues, including the discs in the neck. This forward head position causes significant strain in the muscles in the upper back that actually help to hold your head upright in neutral posture. This forward head posture can especially be a problem for those of us who may actually have office jobs who spend a lot of time behind a computer. We spend all day long behind our computers with our heads tilting forward, going into the computer. Then we drive in a slouch position out to the trailhead, and then we go on a 2-hour bike ride with improper bike fit or improper posture. And before you know it, it can really add up to become a neck pain problem. Thus, it's imperative that we correct our on-the-bike posture and even our off-the-bike posture to be able to help treat and prevent neck pain. So we want to show you some of the differences with your bike fit and bike setup. If you have handlebars that are pulling you too far forward, whether they're too wide or the stem is too far, this causes an excess rounding in your back, and what you end up having to do is lift your chin to be able to see where you're going. I'm exaggerating it so you can see the concepts. If you allow yourself to have a more natural bend in your elbows and you have a reach that's not too crazy long, then that allows you to be in a much more relaxed position in your elbows. It allows you to be able to keep your shoulders back. You're still able to bend forward at your waist, but keep a nice rounding in the back like we talked about in the lower back pain video. And then the most key factor is the ability to be able to keep your chin slightly retracted in this way versus letting it protract out that way. It's this protraction of your head which again causes a lot of issues with neck pain. And so you want to set the bike up so that you can have the relaxed but pulled back shoulders and then retracted chin slightly this way. So a much more fun topic to talk about, and that is bike setup. We should be thinking about what can we do to minimize the force that's transmitted from the ground through the bike and into our bodies. The first modifiable factor, and perhaps the easiest and it's free, is considering your tire pressure. There's been some research done on tire pressure and the fact that while higher tire pressures actually do decrease rolling resistance and improve efficiency, there are diminishing returns as you go higher and higher with your tire pressure. Meaning, if you go with too high of a tire pressure, it can actually start to be counterproductive. When your tires start to ping off from rocks and you're being bounced and jarred around on the trail, it actually becomes more inefficient. Do your own research and see if you can actually lower your tire pressure to be able to give a more supple ride and actually allow the tires to be the first component in letting the tire soak up some of the energy from the trail. Second, suspension setup. When is the last time you've done your proper front fork maintenance? If your front fork is dirty, dried up, it's certainly not going to be as efficient at minimizing the forces coming up from the ground into your body. Do the proper maintenance for your suspension. And then your suspension setup. How is your rebound? A rebound in your front fork that's too fast, as you likely know, will cause a harsh ride because it's bouncing back much firmer into your arms. Similarly, if your rebound set too low, what happens is when your fork goes through a compression on the first hit, all the subsequent hits, the fork actually remains in a pat down state, and that really creates a harsh ride. So be sure that you have your suspension dialed in to be able to help minimize the stresses coming from the ground to you. Next, your grips. As you can see, I'm using foam grips. I'm actually a big fan because that can actually minimize the vibration that's coming up through your hands and your arms and into your neck. It's a super cheap modification that you can make, especially if you're dealing with neck pain. Then, if you love spending money, get yourself a set of carbon bars. In fact, I don't notice a huge difference from carbon bars, but I do think that they actually reduce the vibration that comes up through your arms from the ground. Do I think that it's worth springing a bunch of money for? Not necessarily. Try all of the other variables, and then if all else fails, it might be worth considering a set of carbon bars to reduce arm fatigue and shoulder fatigue that you can get from all of the increased vibration that a harsher bar can provide. Another thing to consider is your technique. I see a lot of mountain bikers taking very rough sections of trail while in the seated position. That obviously allows all the force to come up through your bike and directly through your spine. And if you're having neck pain or headaches or other problems in your upper back, that can really aggravate it. So you want to think of your legs basically from your ankles into your knees and into your hips. That is a shock absorber that's built into your body, and it's a much more aggressive riding position. If you're sitting a lot, try to learn to stand in the more rough sections of trail, especially if you're going downhill or through rocky or rooty sections. That can allow your knees and your hips to be able to absorb much of the shock. So one thing that we want to try to do is maintain proper posture while off from the bike. The last thing we want to do is have poor posture for several hours of the day while you're behind a computer or driving or otherwise, and then go spend another couple of hours with poor posture on the bike. A simple way to do that is to take a rolled up towel. Depending on the chair, you can put it horizontally this way in your lower back, and that will provide an adequate lumbar support. And you can see how that draws back my shoulders, and it just naturally brings my head back over my shoulders in better alignment, as you can see there. Some chairs that slope backwards, you might actually have to roll your towel and place it vertically down to your lower back. And again, you can see how that naturally brings my shoulders back and my head in better alignment. So we're now about to go into the treatment and the exercise portion. Before we do that, if you tried to go full send, but instead you went full over the bars and had a trauma, you need to get imaging before you start a program. Similarly, if you're having any significant radiating numbness, tingling, or weakness in your hands or upper extremities, or if you're having severe pain or severe headaches that just came out of nowhere, you need to get a medical evaluation. Otherwise, if you're just dealing with a nagging neck pain or stiffness or headaches that are clearly associated with sustained postures on the bike or at work, try these exercises at your own discretion. Now on to the exercises. If we're trying to counteract forward head posture this way, the most simple and effective way that we can do that is to move in the opposite direction. You can do that by way of what we call a chin tuck. You slide your head and your chin down and back, keeping your head level, sliding your head over your shoulders by engaging the muscles in the front of your neck that draw your chin in and back. Sometimes it's helpful for patients to think about drawing their chin into their throat. You're trying to keep your head level, you're trying to take it back as far as it can go without tilting backward or shrugging. You're keeping your shoulders relaxed and drawing your chin in and back. For acute neck pain, you want to do this as much as 4 to 6 times per day, spread throughout the day. Or for preventative maintenance or for improved mobility, you can do this a couple times a day or before or after a ride, and you should notice an improvement in your overall neck mobility and your ability to hold your head up in better postural alignment. One important aspect of neck health is actually mid-back or thoracic spine mobility, flexibility. One key way to do that is to be able to take your posture roll, slide it up to your shoulder blade area. You can clasp your elbows like so and lift your elbows and arch your head and back over the towel roll. You want to start slow and easy and then work your way further back with each repetition, doing 10 repetitions, filling the stretch right at the towel roll in your middle back or shoulder blades area. This does a phenomenal job of counteracting the rounding in your middle back that you take from being on a bike or other daily tasks, and can be quite helpful in improving your mid-back flexibility and decreasing your neck pain. Do this pending it does not aggravate your neck pain, or if you're having headaches, it does not increase your headaches. One exercise that's particularly helpful in opening up the joints in your upper neck that actually get compressed when your head is forward is by sitting upright in tall posture. Take your hand and lift up, drawing your chin down to your chest, and hold. And you can hold this for as much as 10 to 30 seconds, whatever you find helpful. This is especially helpful if you're having headaches that do seem to come from your upper neck, and you can actually pull up almost like a form of self-traction, and you're drawing your chin more down as you try to counteract that in the back by pulling up, and you'll feel a stretch right at the base of your skull, opening up those joints and stretching the muscles in the very upper part of your neck. And again, doing a 10-second to 30-second hold. And you can do this as much throughout the day as you feel necessary to get relief of those headaches and tension in your upper neck. And it's a good adjunct to the other exercises that I'm showing you. Now, a variation that we commonly use for the chin tuck exercise is to actually have the patient do it while lying on their back. You can just draw your chin down and in and feel the back of your head crush the pillow. You're not doing it by driving the back of your head back, by tilting your head back this way and lifting your chin. You should feel like you're drawing your chin down and in while crushing the pillow. Do your best to keep your shoulders relaxed. You can hold this 3 to 5 seconds. This really helps to strengthen the posture muscles in the front of your neck. And if done correctly, it can even open up the joints in the back of your neck. This can be a good option for those that have a particularly stiff or painful neck that are unable to initially tolerate the seated position exercises. And this should open you up to be able to tolerate those sitting exercises better. And you can do this a couple times a day, once in the morning before you get up out of bed, and then once in the evening prior to going to sleep. 10 repetitions each, 3 to 5 second holds. Another progression of the chin tuck exercise that you can do in the seated position. You can place a pillow behind your head in the seated position, rest the pillow between your head and the wall, and you can draw your chin back and crush the pillow with your head. You're not driving your head back this way by tilting it back and lifting your chin. You're lowering and drawing your chin in and back, and it should feel like your head is sliding back. You can hold this exercise for 3 to 5 seconds and try to feel it engaging in the muscles that are deep in the front of your neck. These muscles have been shown in the research to have some effect at improving forward head posture and decreasing chronic pain. You can do this exercise 1 time per day, 3 to 5 second holds, 10 to 15 repetitions each. One thing that you can do prior to your exercise regimen is actually heating your neck up by way of a heating pad or a nice warm shower. You can put a heating pad on there for 10 to 15 minutes. Heat does a nice job of helping your stiff and tense muscles to relax to help you tolerate the exercises and stretches better. One way that you can quickly and easily self-treat your own muscle tension is to actually grab a racquetball or a tennis ball or something comparable and actually do a soft tissue release. You can do that by placing this between your neck and the wall on either side of your spine. There are muscles that run down both sides of your spine. You can put this there and you can essentially, with your legs, roll up and down. It's almost like foam rolling on the small muscles of your neck. And if you find a trigger point that has a little bit of tenderness to it, you can actually do a bit of the chin tuck exercise where you draw your chin slightly in and you can hold that pressure on there while you release that trigger point. Usually to get a good release on a tight spot in a muscle, you have to hold it anywhere from 15 to 30 seconds. And then you can release that push with your chin and then continue rolling. And this is a good thing to do after heat, but prior to the other stretches, just to be able to help decrease some of the muscle tension and help you tolerate the other stretches. Strengthening your upper back can be extremely important to be able to help alleviate and prevent neck pain. One simple way to do that requires no equipment whatsoever is what we call a prone cobra. This is where you lay flat on your stomach. You have your arms by your side. You pick your upper body up, squeezing your shoulder blades and draw your chin into a chin tuck. Hold it 5 seconds and then slowly release. Upper body goes up, shoulder blades squeeze together, chin draws in. Hold it 5 seconds and then release. This again works the core muscles in the front of your neck, but it also helps to work the upper back muscles that help keep your shoulders pulled back in a better posture line. You can do this exercise as much as 10 repetitions, 5 second holds, and you can do this 2 or 3 times a week and probably get plenty of benefit from it. You can even do it 4 or 5 times a week if you're really needing more upper back strengthening. We should strengthen our upper back and our shoulder blade area to help support our posture into a more upright position. A foundation exercise that you can do for that is to actually go into this position with your arms, and then you can squeeze your shoulder blades back and together and then depress your shoulders, your shoulder blades downward this way. This engages the muscles that actually help to pull your shoulder blades back and down into a better position. You can then take that a step further by picking up some exercise bands or tubing. Get a light to medium resistance. With tall posture, really upright in your back, you can pull your shoulders, squeeze your shoulder blades back and down. You want to hold that for 5 seconds and then release. If you hold it for a good 5 seconds, doing about 15 repetitions to 20 repetitions is going to be a pretty good workout. You can do that about 3 times a week and get a really good upper back strengthening program. Thanks again for joining me with the Biking with Pain series. If you know someone that has such poor on the bike posture that you lose sleep at night over it, share this video with them. Definitely subscribe to the channel, turn on those notifications so that you can stay up with me on the latest Biking with Pain series videos. Follow me on Instagram. I'll leave a link below at Dr. JMTB. Also, leave a comment in the comment section for any pain problem that you'd like to see me cover in the Biking with Pain series. As always, thanks for watching.